Welcome to Just a Dog podcast. I am your host, Nadine. In this episode, I am joined by Dr. Lisa Radosta. Lisa is a board-certified veterinary behaviorist and the current president of the American College of Veterinary Behaviorists. She is also a speaker, an author, consultant, and expert witness with more than 2 decades of clinical experience working with dogs, cats, birds, and small mammals whose behavior has become distressing, dangerous, or misunderstood. Lisa is one of a small number of specialists worldwide who are trained both as veterinarians and as behaviorists. That means that she looks at behavior through the lens of physical health, emotional well-being, learning history, and environment, rather than treating behavior as a training problem in isolation. She's the former owner of Florida Veterinary Behavior Service, has contributed to major veterinary textbooks, lectures internationally, and regularly advises other veterinarians, organizations, and courts on complex behavior cases. Her work focuses on reducing suffering, preventing relinquishment, and helping people make informed, ethical decisions when the stakes are especially high. In this episode, I speak with Dr. Lisa Radosta about how much of what we label as behavior problems is actually rooted in unseen pain, fear, loss, confusion, or human inconsistency. Her perspective makes it clear that dogs don't misbehave in a vacuum. They live inside bodies that hurt, nervous systems that remember, and environments shaped almost entirely by human choices. And when we begin there, the way that we respond to behavior changes completely. This conversation is worth listening to because it moves beyond fixing behavior and instead asks us what it really means to care for dogs well, especially when things are difficult and the answers are not simple. Hello.
Hey,
I'm Nadine. Nice to meet you, Lisa.
nice to meet you.
Thank you for joining me today.
It's my pleasure. I watched some of your podcasts, since you reached out, and so I'm interested to talk to you.
I would like to get to know you as an individual, as a human being, and really get a feel for who you are and what inspired this path, this life choice of working with dogs and cats, I think it is.
So veterinary behaviorists we can work with any species, but I only see dogs, cats, avian, and exotics. So I don't see horses or cattle or goats. I feel like to do something really well, you have to do it a lot. And I just, in the beginning, wasn't seeing enough cases where I felt like, wow, I'm going to be able to do my best. So dogs, cats, and then parrots and budgies and all kinds of cute little birds. And then pocket pets, we call them over here, like ferrets and bunnies. And so who am I? I'm a mom. My one daughter will be going to college soon, and I'm excited and devastated, which is what moms and dads feel, I guess, proud and sad at the same time. And I knew I would say I was in second grade, that I knew that I wanted to be a veterinarian. And I also loved training dogs. There was an English trainer. What was her name? She used to say walkies all the time. It's before you were born, I bet you.
I was going to say, how far back are we going here?
I was 6, I'm 56. So 50 years ago. And she used to say walkies. And I had her book, and I just was like, God, I just want to be like this lady. So I loved training dogs. So when I got to vet school, I knew that I wasn't set out for general practice. It's just not for me. I knew I wanted to specialize, and behavioral medicine fit. Like I could see myself doing it, like I wanted to do it. I wanted to talk about it. I wanted to talk to my vet school friends about it. I wanted to explore it. So, that's what you want to do for the next 60 years, is something that you love, right? So that's how I ended up being a vet behaviorist. And then I had this giant business with 4 locations and all these doctors. And then in 2024, I was feeling pretty burned out after 18 years. So I took a break. I took about a year off. Not really off, but sort of. And now I came back into the clinic, which is my love, is to sit with people and their pets and talk to them and try to help them. And so life is good.
That's exciting. What did you do when you were a year off?
So it took me, I tell my girlfriends, because a lot of women my age in their 50s are going like, oh my gosh, I'm trying to do it all. I'm just reaching my limit. It took me 9 months to feel different. like physiologically to come down from that constant hustle of running this big business. But I started writing a book that is pet parent facing, not a textbook. And I worked out and I took care of my kid and I spent as much time with my family as I could. And then I started seeing telehealth appointments after 6 months. And that was really fun. And I was like, oh, I miss this so much. And then back in the clinic after another 6 months.
What is telehealth? Is that online consultations?
Yeah. So you just get on Zoom with people and it gives people anywhere, and the state laws are going to govern where you can see the patient. So I couldn't see a patient who lives in another state. But within my state, I have the ability to help people that live anywhere, even people that live 9 hours from me. Right. So
Yes.
it's a great opportunity, I think, to help people and their pets.
Going back to your childhood, what are some of your earliest experiences of being around dogs and your understanding of dogs?
I'm a Generation X. And a lot of Gen Xers, this was kind of the first generation where we were left to our own devices a lot. And I think my group of girlfriends too, we didn't have the most stable upbringing. And so some days were really bad at home. And every time that I was in that bad moment, there was always a dog, always a dog. And that carried through my whole life from 6 years old, where I got my first dog. Every time it's been dark, there's been a dog. And a dog for me, and it's not that I don't love my cat, because I do. I love my cat and all my cats I've had and my horse that I had. It's just that a dog fills the
Yeah.
space that is empty or that feels cold or that feels dark. And I never had the type of dog that all these people talk about, that when I'm crying, my dog comes. I never had a dog like that. It wasn't like that. They were just there. They were just there if I needed them. And if I wanted to go walk and sit out on the dock behind our house and look out over the bay, there was my dog. If I wanted to have a snack, there she was, even when my house was filled with turmoil that I grew up in. So
Yeah.
the bond with animals was always there. But with dogs, they're like little saviors to me almost emotionally, right? And I think that also drove my search to find a different way to train dogs, because I loved training. And at the time when I was growing up, the training was pinch, shock, choke. That was what we did. And it wasn't even considered, there was nothing wrong with it as far as everyone was thinking. It was the norm, right? But in my heart, I was conflicted. Here's this dog who, in my opinion, saved my life emotionally, pulled me out of the darkest place. And I'm gonna now hurt her because I knew it had to hurt. So that caused the metamorphosis of, like, even way back when I had to search hard to find positive reinforcement training that was accessible to me, where I could learn. This was well before social media. And so we had to search. And yeah, dogs changed my whole life, really.
Do you know what I find incredible about what you just said is that there are so many parallels to that, where what you see is disconnected from what you feel. Within the dog world, maybe more recently, have you seen, observed, felt any kind of things where you felt, wow, okay, we still have work to do in this area?
Well, I think we always have work to do in this area. There is a place for different opinions on the spectrum, as long as we're ethical and we're humane and we're considering the needs, welfare needs of animals. I call myself a pet parent. My friend, who clearly is a pet parent, ain't no way she's anything but that, calls herself a dog owner. There's space for different words, but she and I are on the same page as far as what place our dogs have in our world, how we treat them, how we provide medical care, that we care for their needs, obviously. So I think we have to first accept we're not all going to be the same or look the same or talk the same. I'm good with that. And I don't think that people who have empathy for animals, or believe that animals have emotions, or that believe it's not okay to hurt an animal, are the minority. I don't think that's true. I think that most people who love animals, and my God, there's got to be billions that have animals now across the globe, right? They believe that their dog misses them, that their dog gets scared of fireworks or whatever, that their dog has the right to take a walk or go outside. They believe that if they're eating something tasty, they should give it to their dog because they don't want the dog to be sad. They believe all the same things as me, but they don't understand that when they smack their dog on their butt, that they're violating their own moral code. That's where the education is. So many of us feel the same. We elevate dogs like to the level of children. Absolutely. And we just need to help people understand You wouldn't smack your child on the butt. You wouldn't push your child into a chair at the dining room table, but yet you're going to push your dog's butt down, right? So we just
Mhm.
have to help them understand the parallels. And then I think once they understand them in a way that, which is part of what I try to do on social, is say, like, this is what you're doing with your kids. This is what you're doing with your dog. It's so similar. So I think once they understand, then they're going to understand that they can't treat their dog in a way that they wouldn't treat their child.
One would think that that parallel would lead someone to feel a bit like it's a bit more relatable, right? And easier to understand. But then on the flip side of the coin, there's the I always struggle with
Anthropomorphizing. Yes.
that's the
Yes.
word. I always struggle
Yes.
to say that word. Yeah, which in its own way causes harm.
Yeah. But does it? I don't know. I'm curious about it because I feel like, okay, if I think that my dog has the intellect of my 18-year-old, that isn't fair. Okay. Because we know scientifically the dog doesn't. Okay. So that's clear. If I think that my dog deserves love and respect and space, like my 18-year-old, and God help you if you don't give an 18-year-old space. Good luck to you, right? If I believe my dog deserves that, which is anthropomorphizing, then I'll be in a good space because I'll give my dog space. So I think that it all depends. It all depends. What I want to do is take science. Your dog can reason about to the level of a one, maybe if it's a border collie, 1.5-year-old human being, right? Like this, their ability to understand, to reason with that kind of big part of their brain, prefrontal cortex, is about at that level, we think, scientists think. So if we say that, we know they can't reason like an 18-year-old. Same with your cat, right? But I recently did a post and some people got excited about it and some people got really upset about it. And it was drawing parallels between my 18-year-old child and living with an aggressive dog because I think it's very similar. It's very similar. When my daughter has one of her moments where internally something's bothering her and I say, can you clean the cat box? And she goes, no. And she goes in her room and she slams the door. The worst thing I can do is go in that room and fight with her. That is what parents want to do because they want to say, you're going to clean that cat, right? Same with an aggressive dog. Aggressive dog growls at you. The worst thing you can do is start an argument. It's identical. Walk away. Let them cool off, right? Then my daughter eventually comes out of her room and I say, can you clean the cat box? She's like, yeah, I'll clean it, right? My dog eventually comes back to me and I say, okay, let's talk about giving things back to me. Now I'm going to teach you to give the bones back to me so you don't go all crazy when I walk by you with the bone. It's identical in so many ways. Some people were like, yes, it is. And some people were like, you're making light of living with an aggressive dog. So I don't know. I guess where I'm going with this is I think it's really similar to how we treat people. I do. I think it's similar, but that is not going to hit on everybody's psyche in the same way.
Just going back, you were saying about 1.5, was it the cognitive abilities of a hold on.
1.5-year-old child. Like what I last read was that was the best case scenario. Like the smartest dog.
That's amazing to me because there are genius dogs, aren't there? But so
Yes.
1.5-year-old child, is that across all ages of the dog's life?
Okay, that's a question that I don't know that scientists have the answer to. So what I will tell you, the most I know about it from reading what is published is that once the brain reaches that maturity level, we're not going to gain cognition. Like I didn't gain cognition between 25 and 55. I didn't gain the ability to understand things better, except through learning, of course. But I didn't get smarter, is my point, right? If anything, when you get older, I'm sad to say, you're less able to access the information that you want, not more able.
I can relate to that because the older I'm getting, accessing the information is getting a
Yes.
bit harder. But when I look at how much you've accomplished in your lifetime, it seems like it's only getting better for you.
Well, I hope you're right, Nadine.
Going back to your journey with dogs and how it began, why did you choose to become a behaviorist? And then also, was there a catalyst for you in terms of thinking about dogs in a different way?
So I wanted to be a veterinary behaviorist because I knew specialty practice was for me. It was just my thing. And this was the most exciting space for me to be in. And I truly think my whole purpose is to help pets and their people live less stressful lives. And that was the best way I could see to do that, right? Was to change behavior so people and pets stay together instead of being separated by euthanasia or relinquishment or rehoming or sheltering or whatever the case may be. Yeah, so that's why I chose behavior. I would say that my empathy and connection with dogs from 6 years old has not changed. I just deeply, like sometimes I look at these dogs in the exam room so stressed and I just look them in the eye and I'm like, I see you. I got you. This is all going to be fine, right? What I think has evolved over the past 25 years in being a veterinarian is the connection with the people. Because in the beginning, and some veterinarians still practice this way, is veterinarians, you're sort of sometimes taught us versus them. Like you need to get the person to do the thing to help the pet, not like you need to discover why the person can't do the thing to help the pet, right? So as I've practiced, especially in behavior, I've gotten to that point where I now, when a client says I can't do that, I'm asking why. Not like why, but what is keeping you from taking this dog who bites you? This is a client I just talked to today. Her dog, we have video. I don't know how it is in the UK, but in the US, we have video cameras all over our houses. We watch everything. So she has a video camera in her bedroom. She sends me those videos. That's when the dog is most likely to bite her. And I keep saying, you can't sleep with him. I'm so worried about you. You have to stop this. And she said, no, I won't stress him. I won't move him. I'm not going to do that. And we could butt heads, or I could try to discover by being curious, why? What is it that is keeping you? What are you worried is going to happen if we put him in a separate room or a separate space? So, or I can, like we did today, brainstorm it. Let's take an exercise pen. Let's stretch it all the way around the bed. Your dog's going to sleep in the bed. We're going to put you in a bed next to the bed, but there's going to be an exercise pen in between. Like 20 years ago, I would have been like, just do it, right? What I see evolving is there's a human being there. It's not us against them. It is them and us. And dogs don't have credit cards and they can't come to see me on their own. They can't drive. And if I can't help that lady or that man or whoever, then I can't help the dog. And so that has evolved hugely in the past 25 years.
I think that's a beautiful example of how to get through to dog guardians to get the best outcome. What would you say is the cause of the dog showing aggression on the bed? Because that sounds like a very curious case.
Yeah, so there are many of my patients are aggressive on the bed. This dog does not fit that mold. The patients most commonly that present with aggression on the bed are lying on the bed with the pet parent. This is about attachment, sort of. They have to be next to the pet parent, on top of, next. And the pet parent, because she's human, she rolls over during the night and she nudges them. And they're so anxious and on edge, they jump up and bite or they jump up and bark. That's typically what I see. That is not this dog. This dog is a senior dog. He's got several other serious metabolic diseases. He's under treatment by an internal medicine specialist. And he has sometimes increased hunger. So we are seeing two different bits at night. We are seeing if there's a treat somewhere that got lost in the covers, in the comforter, right? Because a dog can bring his treat anywhere in the home that he wants. And if it's underneath, I sleep with 2 blankets and a sheet. There's plenty of space for a treat to go underneath one. So if that happens, he's living his life. Then the pet parent gets in the bed and he's like, what? Oh my God, you're trying to take my treat. So there's one. Another one that we see with this particular patient is when he doesn't feel well. And it's very hard to know when someone else doesn't feel well. You could be nauseous right now. You could have a migraine. There's no way for me to know, right? And it's the same with dogs. So with this particular dog, we have been very careful about, is there anything on the bed? We've been very careful about the medications he gets, his internal medicine medications and his behavior medications. And this pet parent is, quite frankly, extraordinary because when she has a really bad incident, the very first thing she's going to say is, I'm not giving my dog up. Now, she knows I would never say that to her, but she steps up first and says, you better find a way because he's not going anywhere. And I appreciate that, right? She's being honest with me and she's dedicated to this dog. And so anyway, that's what we're dealing with, kind of a mixture of items, possessiveness, and the hunger driven by the primary disease, and also days when he doesn't feel well and his fuse is a little short.
Oh, poor boy. So that is signs of aggression rather than actual biting, right?
Well, so I had a great conversation with a friend of mine today who's a dog trainer about that. She doesn't use the word aggression. So aggression for a veterinary behaviorist, at least in the US, is going to mean biting, barking aggressively, snarling, snapping, lunging. So we're going to put all that under the aggression umbrella. right? So any of that will qualify.
Wow. Okay. So hypothetically speaking, if the dog had bitten, even if it wasn't like a full on grip, but just like teeth touch skin, is that enough of a reason to make a life-changing decision about whether or not the dog should stay with you?
Well, everybody practices differently, and I don't judge other veterinary behaviorists for how they practice. I give the decision to the pet parent. And I say that, how could I not give it to them? It's their decision, right? What I should say is I don't take the decision from them. So what I talk to pet parents about is the risk, the likelihood that I can keep them safe if they continue to sleep with their dog, which is zero. It's zero probability that I can keep them safe if they continue. Even if I make the behavior 99% better, there's a 1% chance. And when you're sleeping, you cannot defend yourself, right? And the dog is not thinking straight when they do these things. So they're irrational. You're half asleep. I don't tell people if you're alluding to behavioral euthanasia, I don't tell people when to do that. I tell them, this is the likelihood I can keep you safe if you keep doing what you're doing. This is the likelihood I can keep you safe if we implement these changes. How cool is that? Let's do these cool things. And
Okay.
then you'll be safe and your dog will be happier, right? And then we talk about rehoming, which for most of my patients is not an option. There's no place for them to go. And we talk about euthanasia where it's appropriate. Sometimes I talk to people about returning dogs to breeders if they have purchased the dog from a breeder who's a really good breeder. So we will talk about those things, but I feel like it's not my place to tell someone when it's appropriate to euthanize, you know?
Yeah. But then you've got experience on the other side, from what I've read, that you are a expert witness as well. So I would imagine that you would have seen quite extreme cases in court. How do you, in your private practice and then the experiences that you have, like seeing the extreme outcomes of people maybe not taking decisions earlier on or finding solutions earlier on, how do you see that play out?
The time it gets to court, it plays out in a disastrous way. The times when an expert witness is going to be hired is usually when a dog has been killed, a person has been mauled. These are awful cases. These are awful, awful cases. One case, we have a lot of us have fences that are made of wood slats, right? So two pieces like 2x4s again and again, and they're hammered onto crossbars that are made of wood. Well, this is not my patient. There's a case I served in, actually two cases identical. The dogs on one side of the fence pushed the bottom, and like a seesaw or teeter-totter, it came up. They got through the fence. One dog killed two small Yorkies. And in another case, a little terrier, was killed. It's all on video because we've got cameras everywhere in the US. And could those have been prevented? Of course, if people would walk their fence line, if they would just walk their fence line. And in one case, the pet parent or the owners, whatever you're going to call them, of the offending dog knew and actually had someone come out to look at mending the fence, but they hadn't mended it yet. So instead of keeping their dogs on leashes in the backyard, they took a chance. And those are the things that just, you can't go back. This dog is gone,
Too late,
right?
yeah.
Yeah, it's awful.
What about aggression cases when you have a dangerous dog that needs to be assessed? The kind of protocols that are being followed in the UK um, are not always successful in terms of it being in the best interest of the dog, like considering the environment and considering kind of other variables that like a checklist doesn't account for. Is it very different in the States? I'm hoping it might be a bit more advanced.
So it depends on what type of expert witness the court is going to hire, the attorney's going to hire, right? Because if they hire a veterinary behaviorist, we are most likely going to meet the dog, watch videos of the dog's behavior in another environment, because just as my behavior here is different than it will be in 10 minutes or 30 minutes with my kid and my husband at dinner, dogs will behave differently in different environments. They might be more scared when they meet me than they would be in their own home, for example, or vice versa. Okay, so we're going to watch those videos. We're going to watch videos of incidents, if there is any incidents that we need to review, and we'll review medical records. So all of that will come together into an assessment. Frequently, I'm cross-examined or a judge will ask me questions, and they want to know the same thing again and again. Like, what's the likelihood this dog is going to bite again? And I keep saying, I don't know. Because if this dog is muzzled, every time the front door is opened, the probability is near zero. It's pretty darn close to zero. But if the pet parent doesn't put the muzzle on, I don't know.
Odds go up.
Because Yeah, because so much of what dogs do is at our hand. Dogs don't like drive cars and buy guns, and they don't do that, right? They live in our houses and in our yards. And if the person who cleans my pool leaves my fence open and my dog gets out and my dog's aggressive, that's on me. I should have a padlock on my fence. So very often when I testify and they ask me those questions, I tell them the truth. I cannot predict whether any dog is going to bite again, because so much of it is environmental. And any evaluation that I do is artificial. It's one point in time. And maybe I can't elicit a growl today, but that doesn't mean that a 2-year-old child who lies on top of the dog won't get a bite tomorrow. Like, it's just an absurd question.
If a 2-year-old child was lying on top of an elderly person, they might get a growl as well. It's all relative.
Right, right. And I think therein lies the problem, because the court system does have to figure this out. They do have to figure out who is at fault and who should receive damages, et cetera. And is the dog dangerous? And what should they do to protect the public? In the US, my experience is that the pendulum swings very often like far to the area of, oh yeah, it's the owner's fault for sure. And that dog is going to be euthanized. I think the judge ends up in a place of like, the experts are saying there's no way to guarantee it. The dog has done this bad thing. The only way to solve the problem is to make the dog that did the bad thing go away. I think that's kind of where some of their mindsets are. And I think that's unfortunate, but that's our legal system, I guess.
This is the tricky thing, isn't it? What drives the decisions ultimately? It's not necessarily the well-being of the dog. It's always going to be human first, but it's also going to be to kind of cover your backside as
Exactly.
much as possible. Yeah, it's
Yeah.
a shame, really. So many dogs lose their lives because of things like that. But also, I really appreciate your perspective, because yes, there is a lot of human management within those outcomes, things that could have been avoided.
Yes. Yeah. And I think that very much of what we see dogs do that we label as misbehavior or undesirable is something we set them up to do. Absolutely. Now there's some evidence in separation anxiety, which we thought that we probably knew everything. You never know everything, right? So now what we're understanding from some of the research is that it looks like these dogs who have separation anxiety or separation related disorders don't have a hyper attachment. It's more what you said earlier about the attachment style. And it looks like, at least from 2 studies that have been published, that pet parents who have an attachment style to the dog that causes internal conflict in the dog may be more likely to have dogs with separation related disorders. For example, you're my little Maltese and I love you so much and I keep you on my lap and I put you in my handbag and we go to the store together and we're just so in love. And then when you're in my house and you have an accident, I smack you on the butt, right? So do you love me or don't you love me? Because as the dog, I'm unsure. Because people that love me probably don't hit me. I'm thinking that's not love, right? But yet you just did that. But I'm attached to you and I love you and I need you and you need me. But that didn't feel good. Dog jumps on the couch, person pushes dog off. Instead of just directing dog off. Is the dog in physical pain? That's not the point. That's not the point. The point is that the dog gets confused. Which one is it, right? Nobody wants to be with a partner. If I had a husband like that, I wouldn't be married, right? Nobody wants to be with that partner. And that causes this internal conflict where the dog doesn't have a normal attachment. That's why one of the big things I just want people to do is be consistent. Just be consistent, because the consistency helps human children and puppies, by the way, feel safe. They feel safe, and when they feel safe, they don't panic. Those are incongruent.
But then what about cases where you've got a rescue dog, and they come to you with an existing, my life is extremely restricted because I think she's got severe separation anxiety. She cries when I'm not here, even if another person is present.
Yeah.
She'll go into my bed and she'll cry into a pillow like a teenager.
Aw.
It's very sad, but based on what you've just shared with me, I would have a role to play in that. Or is there something else involved from her past before she came to me?
Right, so now we're getting to middle age. So there's life stages, right? We've got the puppies. We're setting them up with consistent interactions. I don't hurt or scare the beings in my world that I love. So I'm not going to hurt or scare you, right? We're going to have a nice, safe, strong attachment. Now we've got a middle-aged dog. The middle-aged dog not only has the attachment that, in your case, she formed with the original pet parent or pet parents. I don't know how many homes she's had, right?
Right.
But we have all the learning, right? So, for example, some dogs learn that in their mind, they've made a connection that when they are alone, it's more likely to be a thunderstorm. When they're alone, fireworks are more likely. Now, we know that's not true. The fireworks would have occurred either way. But if the pet parents are out on the day of fireworks, then the dog goes, oh, yeah, no, when I'm alone, those fireworks happen. That's bad news, really bad. I'm not going to be alone. Then we also have on top of that, that your dog in some way was abandoned, whether it be through a breeder or a rescue. She went from a home to a home. So now, and it's not like when my daughter holds my hands and says, Mom, it's going to be okay when I go to college. You're going to be okay. Like, you don't have to cry. It's not like that. No one could hold your dog's paws and say, you're going to be rehomed, and I know you're going to get a great home, and just, you can do this. I know, right? Your dog had a family, then your dog didn't have a family. So that loss is like PTSD, right? That's a
Right.
loss. And of course, you come along and you're kind and you're consistent and you're loving. And she says, oh, no, you can't leave because I went through this before and the other people left and it was very bad for me. And I ended up in the shelter. So you can't leave. So you didn't do anything wrong. You have the power to do everything right. But your dog came to you with pre-existing baggage that is causing her to say, you are safe. You can't leave me because then I'm not safe.
That's so sad.
I know.
That's
I
so
know.
sad. Is there a way through that? She's 7 now. Is there hope for her, or is this kind of fixed where she just doesn't trust life?
Well, so I just had this conversation with a client the other day. She has a rescue dog. He's probably 3, so he's younger than your dog. And so what we do with separation related disorders is we try to figure out, do we need a medicine or not? Because if we do, we want to do that. We try to look at the dog's whole well-being. Is that dog healthy? This particular dog has inflammatory bowel disease. So we had to work to get that under control too, because when he would have a flare-up, his fuse would be really short for his mom departing. Like, that wasn't going to happen, right? Because then he really feels unsafe because he doesn't feel well. Okay. So we make sure the dog is healthy. We look to see if there's a medication we can use. And we use that primarily so the pet parent can have a normal life. Because this particular family, they couldn't leave at all. They could never leave this dog. So one pet parent would have to go grocery shopping. The other one would have to stay home. They couldn't go to dinner. They couldn't go to the movies. They couldn't go anywhere. So we use medicines in order to give them a window. We're up to 2 hours. We have a 2-hour window now that they can leave with medicine. So then we start thinking about, well, what can we do with cognitive therapy? And so people say, well, how am I going to train this out of my dog? And I say, you're not going to train it out. This is not training. Training is like going to get your PhD. It's like up here in the prefrontal cortex. That's not what I'm talking about. What I tell people, and I don't know what the equivalent would be at the UK, but we have 2 parties here. We have Democrats and Republicans, and they just fight all the time. So, and people are very indoctrinated. So I tell people, treating separation anxiety is like you're a Republican and your mom's a Democrat, and you are going to change your mom's mind.
Oh, yeah. Good luck.
Good luck. Right. So it's not that it can't be done, but you're going to pummel away at it for a long time. So for separation related disorders, very often we can use a medicine and something distracting or delicious or fun for the dog while the pet parent is gone, especially if the pet parent's only gone like 2 hours at a time. If it's not like an 8-hour workday, we can get away with just that. And then there's 3 ways, just general umbrella ways, that you can treat separation related disorders with cognitive therapy. Number 1, if you have a dog who likes to eat, which most greyhounds aren't like that. Does your dog like to eat?
She is so food obsessed. Yeah.
Okay.
But when I leave, if I leave, and this could be to take the rubbish out, it could be to go get some milk, whatever I've left for her, whether it's a stuffed Kong, it could be a raw marrow bone, it could be like a high value treat. She won't touch it while I'm away.
Yeah, this is really common because your stress response and your appetitive response kind of negate each other. Like when I'm stressed and I go and eat some gelato, salted caramel gelato, I feel a little better. It's probably not the best coping tool, but I like it. But dogs, when they're stressed, they'll shut down that eating drive, right? That drive to eat. So for your dog, we might use a little medicine and we might also do a preference test because there's lots of times that dogs won't eat when we're gone. And we've really given them some lovely things. And if we just do a preference test, do you like chicken more than beef? Do you like cheddar cheese or mozzarella cheese? Do you like regatta cheese? What do you like? and we find something the dog just flips over, that with that little bit of medicine, we can get the dog to eat while the pet parent's gone. There's studies that show that chewing helps fearful dogs, actually, even more than dogs who aren't fearful, to calm down. There's studies that show that if you give a dog a calm toy, that not only will they be calmer when separated from the pet parent while they're eating it, and I'm saying calm toy, it could be any stuffed toy, while they're eating it, but also for 15 minutes after it's empty. We know this works. So sometimes we just drive dogs to eat with a little bit of an appetite stimulant or an anti-anxiety medicine, and then make sure they have food toys to keep them occupied. So for the cognitive therapy, we're going to make sure that the departures are always predictable, because we don't want confusion or conflict, right? We used to tell people, oh, mix it up, leave for 2 minutes, pick up your keys, put them down. That just seems to really confuse dogs. We just tell people, be consistent and be low key. Just be low key about everything. You're leaving, you're coming home. It's not a big deal, right? Then we can do some structured therapy with dog training professionals. One, and it might work for your dog, maybe, would be using a remote control treat dispensing device. So there's so many of them. There's the Furbo, there's the Treat and Train, and we teach dogs to lie down on a mat, which most dogs know how to do. They could lie on a sofa, they could lie anywhere, it doesn't matter. And I don't even care if they sit, frankly. They're just going to be in one general place. And we reinforce them from the remote control treat dispenser. So not you handing a treat, for being in that spot. Then we slowly work up to, we're not trying to sneak out. They can hear you and see you. We slowly work up to you being gone for longer and longer periods of time. Way number 2 is we teach dogs to relax on a mat. And people usually say to me, my dog knows place. And I say, yay, you're 25% of the way there. What we have to do is get your dog to take a deep breath on the mat, settle down on the mat, feel really safe on the mat. Okay. Then once he does that, we're going to slowly expose him to your departures. Then there's a third general way. These are general ways. There's always tweaks on these things, right? The third general way is to not use any food and to use your return as a reward for the dog. My experience with this is that it takes a very long time. It's quite taxing on the pet parent because they can't go anywhere. They don't have a way to get out quickly, whereas food toys kind of get you out the door if you can get them to work. And I think it can feel overwhelming. You know, you're making a 20-second departure here, a 20-second departure there. It's just a lot. So there are ways we can treat separation-related disorders with cognitive therapy, but we're going to start with cheap, easy, humane food toys, preference tests, a little bit of medicine, keeping things low key, and helping your dog to understand she's going to be okay without you there. It's very doable. It's doable. I think the likelihood, my client said to me yesterday, because her dog's doing well, and she goes, okay, now let's aim for no medication, and I'm going to leave spontaneously, because right now we're using medicine and she has a whole routine that I have her going through. So the dog knows exactly what's going to happen. She goes, spontaneous departure, no medicine. And I told her, I said, it's very close to 0 probability we will ever get there. This is a rescue dog with trauma. Like, this is not realistic, but it's realistic to think that with a little medicine and with some cognitive therapy, that you could have a really normal life and be able to leave your house and go to dinner and throw out the garbage and all those things. So I think we just have to level up our expectations, and there's just plenty we can do. Plenty.
Okay, that gives me hope.
In the UK, you have the University of Lincoln. I don't know how far, because I put all that science into my head, and geography fell out. It's far. So sometimes I don't even know where. So the University of Lincoln has Dr. Mills. Everybody knows who he is. He's amazing. So he is a board certified veterinary behaviorist in the UK. He's got the UK designation. And like I said, world famous. So that may be really far from you and you can't get help there. But if you call there, they can tell you how you can get help near you from a veterinary behaviorist. Because I'm sure that most of the vet behaviorists in the UK were trained under Dr. Mills. I mean, he's the guy.
Okay, I will definitely reach out to him. I think I know this, but just to be sure, what's the difference between a board-certified veterinary behaviorist, people that say they're behaviorists, or a clinical behaviorist?
Yeah, so terms might be different in different countries, right? So Europe has a designation, UK, we do. There are other countries, I think Brazil does. So it's just going to depend on what where you got your designation from. But a board certified veterinary behaviorist is generally going to be a veterinarian who did a residency and then pass through the board certification process, which is usually a research paper, case reports, and a board exam. A behaviorist, at least in the US, is anybody. Anyone can be a behaviorist. It's like a general term that implies that you do something with your career that has to do with behavior, right? Then a clinical behaviorist, we don't really use that term here, but it could be equivalent to an applied animal behaviorist. An applied animal behaviorist is someone who has a PhD. So we call them certified applied animal behaviors. CAAB is what you'll see after their name. And they have gone to a higher level academically, right? They have a PhD and they're going to be diagnosing behavior problems. Absolutely. So let's say that you did not have a veterinary behaviorist in your area. You didn't have access. You could go to a certified applied animal behaviorist. They could diagnose your pet, make sure that she actually does have separation related disorder. They could make a really great cognitive treatment plan for you. They can't recommend or prescribe medicines, at least here in the US. So you might work with your primary care veterinarian and say, hey, do you feel comfortable prescribing a medicine in addition to this plan written out by this certified applied animal behaviorist? And then what you will also see is you'll see just dog training organizations giving out certificates that have behaviorist in them or behavior consultant. And it's like an alphabet soup of letters after people's names, but you can take those letters and put them into your Google search or ask ChatGPT or Claude or whoever you like, and it will tell you that certification. And then you can go online and look at it and see, like, was that a test that a person took? Was it coursework? Did they have to train a dog in front of someone? And then you can decide if you feel like that's someone I want to work with or not.
So let's imagine I didn't know you existed and I never looked at your social media and a specific post, and I went and looked for a behaviorist, or I found a trainer and I said, this is my problem, my dog's got anxiety, I think, and they recommended I use certain types of vitamins or changed my dog's food, or maybe they even said, you know what, try this medication. Why is that a bad idea?
Because they're outside their lane. They don't have the knowledge to recommend that product, and it's not safe. That's the biggest thing. When we start to take control over the treatment of someone's animal, and if you're a dog trainer, you are treating the animal. You can say it any way you want. You are changing that animal's behavior. You are treating a family member. Number one priority is to not hurt the animal. And that includes supplements, foods, etc. I want the people working on my dog and cat to be experts. I don't want my surgeon to steer out of her lane. I don't want her to do something she's not skilled enough to do because she's going to hurt my pet, right? And that is the same for a dog trainer who recommends food. And there are nutrition certificates that any of us can get that is not the same as a board certified specialist. A certificate is a course. A specialty is 3 to 5 years. It's the board exam. It's all the things, right?
Okay.
So that's my concern. And I'm an expert in my field, but I'm the first one. My mother calls me and says, Lisa, like, what flea and tick control should I give my dog? I'm like, Mom, I'm a psychiatrist. Like, how would I know that? Like, I don't know. It's outside of my lane. I think I really respect people that say, you know what? I don't know about that, but here's the name of someone who knows. Here's the book where you can find that thing. I don't want someone taking a risk on me or on my pets.
What about, just hypothetically speaking, someone who might be like, oh, it's just a supplement. Oh, it's just a vitamin. It's harmless.
Here's the part of the problem. So I talked to you about my patient who has separation related disorder and has IBD. So a lot of the supplements we give dogs, all but one that I can think of in the US, there may be more, but all but one are flavored. This dog is on a hydrolyzed diet. Every bit of anything is going to cause a relapse in his diarrhea, which is going to cause him to go to the internist or worse, end up in the ER. So something as simple as flavoring. If you as the dog trainer don't understand he's on a hydrolyzed diet and you recommend that he go on a flavored supplement, it literally could be pancreatitis, GI distress, ER stay. Another thing is I don't think, at least in the US, when something's natural, it is thought to be totally safe. Eat a box of it, for God's sake. Just do what you want. That's not the truth, though, because especially these supplements that modulate brain chemistry can interact with other drugs. There's only a handful of neurotransmitters that we care about in behavior. And if you're giving a supplement that alters your dog's behavior, it's probably affecting serotonin, norepinephrine, dopamine. Maybe it's in an indirect way, like CBD affects cannabinoids, but it also affects other neurotransmitters. So maybe it's indirect, but it still affects them. And also, dang it, the supplement industry is not well regulated in the US.
Yeah.
We do have some supplements that are made by pharmaceutical companies. And it's not that I think that we should all buy things, from pharmaceutical companies. It's that if I'm going to put it in my dog's mouth, somebody's going to be responsible. Somebody needs to have told me that there's a study that shows it's safe for my dog, or it's not going in his mouth, period. Right. But these supplements, no one's testing them. No one's giving them to dogs and seeing if it causes heart disease or kidney failure. And actually, some of the studies, when you look at human supplements, if you just go to Google Scholar and you search, I don't know, natural products or supplements, ingredients analysis, something like that, you will see reams of studies showing that very often, like 50, 75% of the time in these studies, what is on the label is not in the bottle, or what's in the bottle is not in the label. Like, this is really frightening. So
Yes.
supplements are natural. I love supplements. I take a bunch of supplements. I'm an old lady. I take a bunch of supplements, but I always take supplements backed by research. I know the company, and I want to be careful about giving things to my pets that might not be safe.
And anyone can sell anything on Amazon, really, if you think about
Yes.
it.
Yes. And on eBay, that's
And
another
on
one.
eBay. Yeah, that's true. Very quickly, going back to the anti-anxiety medication you were talking about before, what happens in those 2 hours, or what effect does that have on the dog? Because I was just thinking, somebody has given me some valerian root,
Yeah.
and I think like she was tripping. I think my
Yeah.
dog was completely tripping. Like her eyes were just like, "Ooh," and I was just thinking, I don't know if that's pleasant.
Yeah. Yeah. I used to take valerian root to help me sleep. I used to call it the dirt pills because it was giant capsules, tasted like dirt. But okay. So this is a really good point. And this is right in line with what we just talked about, which was that these supplements that alter mood alter the dog's neurochemistry. And just like medicines that alter neurochemistry, Xanax and Valium and Prozac and Zoloft, like all these medicines, some dogs are going to take those medicines and feel really sick or feel really weird, right? And sometimes that that weird feeling can cause confusion. And in one of my patients, it causes aggression because he's like, I don't, at least my perception is like, he's like, I don't understand like why I feel this way. So what they're doing in the brain, it depends on the drug we choose. Like sometimes we choose gabapentin, sometimes we choose Xanax. Those drugs affect GABA primarily, and that is a quieting on the brain. It is the neurotransmitter that is kind of ubiquitous in your brain and your dog's brain that slows down the neural transmissions. If we use something that is like trazodone, that's a common sedative in dogs. It's an antidepressant technically, but it helps dogs sleep. In that case, we are quickly increasing serotonin, and that causes a blunting effect. That is like a blanket kind of blunting effect on the dog, even in the way of how much energy the dog has. So there's also, we sometimes use sedatives. We use pregabalin, which is Lyrica. At least that's the brand name over here in the US. So I think the take home for people is every supplement and every medicine is going to have to be personalized for your dog. Might be a different dose. It might be a different medicine. It might mean that you give it 2 hours before you leave instead of 1 hour. What I can tell people, hard and fast rules, never give a medicine for the first time and walk out the door. Always. Or a supplement. Give whatever it is and plan to hang out with your dog so that you can see exactly what you saw. Oh, my dog was weird on this. Like, this is not right for my dog. Might be right for your neighbor's dog, just isn't right for you, right? So that would be the thing I would want people to remember, is to always test the dose and be prepared to change things up.
Just wondering, where would one go for a diagnosis or like to be prescribed? Firstly, I'm a bit hesitant when it comes to medication. I'm not entirely sure whether it's as common here in the UK. It feels like it's trending up now. I'm starting to hear it a bit more, but I'm just wondering because when I've been to the vet, your time with the vet is so limited, and I think for the vet to diagnose behavioral challenges will be a fairly wild guess, I would imagine, in such a short space of time. So
I'm with you. Yeah.
would you recommend we go to someone like you, a veterinarian behaviorist, specifically for things like behavior, psychological related issues? I guess you wouldn't know if you're a layman like me. Like it could also be pain. It could be physical pain, couldn't it?
Yeah. So, a couple things on my YouTube channel, which is my name at Dr. Lisa Radosta. I did a whole thing on separation anxiety that will kind of run people through like, look, here's the behavior modification. Here's what you do. Here's what you don't do. Here's the drugs. So you'll just educate yourself, and that's at no cost. I would absolutely reach out to the University of Lincoln. I would find someone near me who's a veterinary behaviorist. And here's why I think you should start with a vet behaviorist, because we are going to loop in a dog trainer. We most certainly are, or an applied animal behaviorist. But if you start with the veterinary behaviorist, you're going to get the evaluation for pain. You're going to get the evaluation for discomfort. So the reason that's so important, because people say to me, I just had a client say, my bird goes to the vet all the time. I'm sure she's fine. And I'm thinking, how am I going to explain to you she's probably not fine without insulting your relationship with your veterinarian, right? Veterinarians, like you said, have very little time. Here, they might have 15 minutes. So they are trying to get the history on the problem that you're coming in for just today. They're trying to do all the things, get with the technician, go to the next room. There just isn't a way for them to observe how your pet sits, how your pet stands up, that your pet is shifting weight off of their right front leg onto their left front leg. How do you know? Because their paw will be splayed a little more on this side than on this side, because their nails will be worn down on this side, but not on this side. They don't have time to do that. It's awful because I think every vet wants to do that. But the society we've created that vets work in doesn't permit them to do that, right? So going to a veterinary behaviorist, we get an hour with you and we watch everything. And we ask you for videos and we run every test we think is reasonable to run that is recommended. We are going to hunt down pain. And by the way, groundbreaking study that showed on average 50% of the dogs that come to see veterinary behaviorists like me, so not GPs, veterinary behaviorists, that groundbreaking study came from University of Lincoln, Dr. Mills, right by you. So 50% of the animals that come to see veterinary behaviorists that already have a general practitioner are sick or painful.
Yeah, that's high.
That's a huge number. They have general practitioners who are seeing them regularly. IBD, I see so much inflammatory bowel disease, so much. Arthritis. I saw a dog the other day. Now I'm just going on my passionate black hole, but I
Please
saw a
do.
dog the other day. So cute, this big black mixed breed dog. He's just so cute. It's like, there he is. And he's coming in for aggression. He's a rescue dog. He's being fostered. And he's aggressive toward the male pet parent. And the male pet parent had like reached just to pet him. He was lying down, just like reached, and he growled and lunged, no bites. And so I come in because the technician brought mom and the dog in, and I come in and mom's standing up. You can always tell they've got something on their mind because the technician's sitting down. I'm going to sit down. They're standing up. They've got to tell you, right? So she's standing up and she goes, Dr. Radosta, I think this dog's painful. This lady found me through her vet. She has a vet. The dog went to the vet. And I looked at him and I looked at her and I said, I'm 100% sure he's painful. I was in there 60 seconds. I said, first of all, his muscles are wasted all around his butt. Dog butts are like, well, you've got a greyhound. You know what a good dog butt looks like. It is muscular, right?
Yeah.
They're
Yeah.
supposed to be round. This dog was not round. There's the hip, and then it was sloped down. All that muscle was wasted away. So we knew that there was a reason why he wasn't able to have those big muscles. And it probably was because he couldn't use his hips properly because he had arthritis. I watched him sit down and then go into a lying down. As he went to lie down, he put his feet like this. And I said to her, dogs plop down. They go like this. They don't go, God, let me get it. I'm like, I think his shoulders hurt too. So we did the whole appointment. Turns out arthritis in the hips, arthritis in the shoulders. I put him on 2 pain medicines. I just saw her the other day. She's like, I can't believe this. This dog is entirely different. Like, that dog was a rescue dog. He would have been put down. There was no option. He had nowhere to go. I just can't emphasize enough. You got to dig deep and find everything because dogs cannot speak for themselves.
Absolutely. But the thing is, you can only speak for myself. I'm very interested in dogs, so I'm driven by curiosity. But even with the little bit of experience that I have now, I'm so limited in my vocabulary. I'm so limited with regards to what it is I'm actually looking for. The immediate thing is go to your vet, if you want a qualified opinion. So board certified behaviorist, up until doing the podcast, wouldn't have been part of my selection. And you were just saying about the muscle, and I know that her her backside muscles are flat.
Oh my gosh.
Yeah. So I am like, literally, as you were saying that, I was like getting goosebumps because I'm like, I need to sort this because she might be in a lot of pain.
Yeah. Greyhounds have good booties. They are
No, she's
rounded.
fairly flat. She actually looks a bit lame, but I'm definitely going to make an appointment. I'm going to have her seen to because now I know where to go. It's not my vet. I'm so grateful that I was able to speak with you and thank you so much for sharing everything that you did. Do you have time for quick fire questions? First thing that comes to mind, just blurt it out. What book or movie that's dog related do you recommend people either watch or read?
Okay, we're going to exclude all my books, which you absolutely should read. I would say they should pick up Who's a Good Dog? Who's a Good Dog is written by a bioethicist, and I recently did a post on Instagram and Facebook about this book. It is an eye-opener, right? It's not a dog training book, but it makes you ask a lot of questions you would never think of asking about being a pet parent.
Yeah, so that's by Jessica Pierce, right?
Yeah, yeah.
I've actually interviewed Jessica. Yeah, she's Dr. Jessica
Really?
Pierce. Yes, and Dr. Mark Beckhoff. I just think they are amazing people, amazing humans. So yeah, I very much put you in that bracket. Yeah,
Thank you. She's
yeah.
amazing.
Yeah, she's really, really lovely. Yeah, I haven't read that book, so I'm definitely going to read that one. What is something dogs do better than humans without effort or training?
Love without any judgment.
Love without. That's true, isn't it? What do you notice first about a dog when you meet them?
I would say their eyes.
What brings you the most joy when you are with dogs?
I think so my dog's passed away. We haven't gotten a new dog yet. I would say that
I'm
the
sorry.
most quiet joy is having him there. Like he doesn't even have to touch me. I would be out by the fire pit. And even now I look over, he's not there, but he would always be just there. And it sounds very plain, but really it's a safety net.
Yeah.
You always have someone who loves you. It's hard for me to talk about him, but you always have someone who loves you. And they're just, if I was watching TV, his bed was there. He was just there. If I woke up at night, he was snoring. Just the comfort of knowing that he was near really brought me incredible joy.
I'm so sorry for your loss. That's really tough.
Thank you.
How long ago
Thank
was
you.
it?
It was so long ago. It was March 2024, and my husband is like really campaigning for a dog hard. We are going to get one. It's just like when you have perfection, it's hard to imagine that anyone could come in after. He was just, but we are going to get another dog eventually. We are.
Okay. What was his name?
Maverick.
Maverick. What a name.
Yeah.
I mean, that is
know.
just so awesome. I love that. If you had a magic wand that could change one thing about the dog world in one instant, what would it be and why?
I would remove shock collars. They'd just be gone. They just wouldn't exist at all. Aren't they outlawed in the UK? Yes? You can't
Yeah,
use them at
people
all
still
there.
use them. They're available under different names.
They
Anti-Bok
would just be gone. You just couldn't
devices.
buy them.
Amazing. I'd sign that petition. And yeah, final question. What gives you hope about the future of interspecies living?
What gives me hope is I happen to be privy to a recent marketing study. And in that study, they interviewed millennials, Gen Zs, and Gen X. So I'm an X, asking them questions like, would you give up your vacation to take that money to pay for surgery for your dog? Would you do this to improve your dog's quality of life? And what I saw in that survey from X to millennial to Z is that the younger kids, it's not just about money, are so closely bonded to these dogs and cats that these are really family members. And I can see it in my daughter. Now I'm an ovo-pescatarian, so eggs, seafood, some types of seafood. My daughter, she was probably the same age as me when I went vegetarian, 15, maybe 14. She was like, I can't do this anymore. Now she's trying very hard to be vegan. We're trying to support her in that. But that is a decision that when I made it, when I was 15, my mom was like, you're crazy. You're going to die because people need to eat meat or they die. Like, this is bad. But now so many of her friends are in the same space. This is normal to have empathy for animals. It's not abnormal anymore. It's very much like mainstream. And that means that the wave is only going to get bigger. Right? We can't go back now. You can't put the genie back in the bottle. They're going to raise kids who are going to be empathetic towards animals because they are. And that's exciting.
That is very exciting. Before you go, you said you were writing a book last year. Is that out already? When can we expect it? And what else is in the pipeline for you?
It's not out yet. I think we probably can expect it at the end of the year. And it is a a book that is written for any pet parent, but really in the voice of a woman. And it explains how our connection to animals can help us heal ourselves. That's really what it is. So, and what's in the pipeline for me is same old, seeing patients, lecturing, writing books, talking to you, that kind of thing, raising my child.
Well, that's a busy schedule you've got there. You've been amazing. Thank you so much for your time, Lisa. And yeah, I hope you have a lovely rest of your evening over there in Florida.
Thank you. You have a great evening too.
Thank you.